Breast cancer is the most commonly diagnosed cancer and is the #1 cancer death in women worldwide. Studies found being diagnosed and undergoing breast cancer treatments has impacted women's health outcomes and found that lifestyle factors such as diet is associated with better health-related quality of life. The objective of the study is to evaluate plasma level of phytoestrogen, Genistein, among breast cancer survivors in South Korea and determine the association between levels of Genistein and health-related quality of life in breast cancer survivors. Trained nurses collected demographic, socioeconomic, and lifestyle factors at the time of study enrollment. Clinical factors such as breast cancer stage, times in surgery, and treatment types were collected from hospital medical records. Participants were asked to sign consent form at the time of study enrollment, and the study was approved by the institutional review boards at participating institutions. Plasma genistein level was measured by Orbitrap liquid chromatography mass spectrum at the University of Hawaii Cancer Center. Participants completed a validated Korean version of the SF-36 health survey to assess their quality of life. Statistical analysis was done on 407 participants, and participants were classified into tertiles according to their plasma phytoestrogen levels. The median value of health-related quality of life was calculated for each tertile, and subgroup analysis was conducted to analyze the associations by menopausal status. We found the mean age of participants at time study was 52 years old, and the body mass index, BMI, was 23.89. Plasma genistein level ranged from 1.7 nanomolar to 2,073 nanomolar, and the mean nanomolar was 144.69 nanomolar. The most represented age group was between age 50 to 60 years old, and nearly 48% of those women were in the highest plasma genistein tertile. 85.5% of study participants were post-menopausal women, and 90% of those women were in the highest tertile. The mean physical component scores of study participants was 49.55, and the mean mental component score was 49.21. Subgroup analysis by menopausal status revealed there is a positive borderline statistically significant relationship between genistein level and social functioning domain score among premenopausal women. Given the nature of the cross-sectional studies, we were unable to determine a causal relationship between plasma genistein level and health-related quality of life. Since only one phytoestrogen type was analyzed at the study this time, we are unable to determine how much phytoestrogen impacts health-related quality of life without considering other types. The findings of this study suggest beneficial effects on genistein may depend on women's menopausal status, and further studies and investigations are necessary.